will have a case presentation on reversing liver cirrhosis through fasting by Dr. Jenny Kalathil. She was a consultant physician for CCRYN, and at present she is a chief medical officer at Jeevanam Natural Hygiene Center, Thrissur. Dr. Jenny Kalathil, I request you to present your case on reversing liver cirrhosis through fasting.
Thank you. Thank you, Rita. Namaste, everyone. I'm Dr. Jenny Kalathil, and today I'm here to talk to you about the reversal of early liver cirrhosis. In regard to this, I shall be making use of a particular case that I had dealt with in the year 2019. It was about a 40-year-old male suffering from chronic liver parenchymal disease with chronic alcoholic addiction, pangastritis, H. pylori infection, impotency, obesity, and depression, etc. Let me start with some general information about the attitude in which I usually approach the cases. In normal course, I do conduct treatments and not basically aiming at the research opportunities it brings or any academically oriented statistics that it creates. Instead, I'm more concerned with the therapeutic results that can bring from a proper application of my treatment methodology on the patient. Therefore, when I was asked to present a paper on the achievements of fasting, I basically had in hand not many records to present it in front of such a crowd than the innocent verbal testimonies of my patients. Still, I would like to present this case experience with the minimal clinical records I have in hand. It is a case of fasting for 24 days merely on water. Actually, this is not the only case I have in records on long fasting. I even have experience of making patients fast for more than 50 days and more, that too twice with the same patient, and so on. I'm not presenting those cases here because those were not intentionally research oriented, and hence I don't carry much clinical reports about them. This particular liver patient approached me in 2019. He, as I said, was addicted to alcohol and was suffering from defective health conditions such as gastritis, insomnia, impotency, fatty liver, obesity, depression, and several other health problems for many years. Let me illustrate the results this way. Is the screen shared?
Not yet.
Rita, is the screen shared?
No, not yet, not yet. Can you try it one more time? Yes.
Now?
Can you please switch to PowerPoint? Yes, perfect.
You can see the screen, right?
Yes, we can.
Okay. This is his ultrasound scanning report just before I started the fasting therapy on him. In this, we can see the enlarged size of the liver, signs of chronic liver parenchymal disease, splenomegaly, and we could also see the signs of early cirrhosis in him. Even in his liver function blood test, the liver enzymes are seen to be high. The endoscopic conditions of pangastritis. Soon after consultation, he was diagnosed with chronic liver.
Dr. Jenny, we have some issue with your Dr. Jenny.
Had a thorough conversation.
Dr. Jenny, can you hear me?
And he realized that the nature cure treatment would overcome the situation. Now, yeah, is that
Dr. Jenny, kindly turn off
am
your
I
camera.
audible?
There is an issue with your voice is cracking. I think it's a bandwidth issue. Just switch off your camera and you can continue your presentation.
Okay.
Yeah, thank you.
Okay. Okay. Now, let's switch our attention to the methodological aspects of the treatment I applied on this case. Our treatment method is fourfold. That includes in it ample rest, correct diet, systematic exercise, and proper awareness program. According to the principle of naturopathy, as we know, it is the body heals by itself. This again only is a philosophical presupposition. Yet, on closer observation, we could see this principle getting actualized as a reality in the when he is put into a state of abstinence of all food, which alone brings the patient ample. Let me emphasize the word ample here, because without a sort of rest, as I mentioned here, the patient will not be able to fully delve into the deeper realms of his mind. The influence of our proper awareness as part of the fourfold methodology works out at an unconscious level of the mind. And this function of the deeper realms of the mind alone can give a real command to the body to heal by itself. It basically is a kind of epistemological correction, which happens at the core of the patient's psychological level. And unfortunately, the latter change, that is the psychological ones, cannot be recorded with any available laboratory observational methods so far developed by the scientific community. Now, let's have an eye on the clinical reports of the patient to justify the curiosity of everyone other than the patient. For the patient is satisfied merely by the easiness he feels himself at his own personal level. Let me use the clinical reports to explain the results further. After the treatment period ended, his ultrasound scanning report showed that his liver and spleen size had come back to normal. No splenomegaly reported. And also, the report showed improvement in both parenchymal dysfunction and liver enzymes. In addition to it, I could not find much of a sign of cirrhosis left in the report. And he had already reduced about 13 kilos of his body weight by this time. His abdominal circumference was reduced from 40 to 35 inches. No gastric irritation did he feel. And he had already stopped taking psychiatric drugs for depression from the very day he had started his fasting. And finally, to sum up his results, that the patient is now seems to be no more impotent and insomniac. Also, let me display another scanning result that we had taken 1 month after the treatment. This shows the consistency in health he could maintain even 1 month after the treatment fully got over. Well, that's all about from me this time. And the rest is left up to you, the researchers, to fill in the blanks. Because I still don't know what actually took place within the body when we put patient into fasting. We would frankly admit the fact that not as a proper researcher, but merely as a partial observer or a journalist that am I narrating this incident in front of you. Further, I could maximum do is to explain the event philosophically, observationally, or clinically about what was actually happening with the patient. But I would again admit the fact that I don't know how it all takes place scientifically, in the sense that I would not be able to present this case in the same standards as it is demanded by the modern science these days. That is, with a proper hypothesis, observations, facts, experiments, theory, probability statistics, and in its infallibility, and so on.
Dr. Jenny?
Yes.
Yeah. We are done with the presentation.
What? It's not audible?
Yeah, you are audible. I'm asking, we just have another minute left for your presentation.
Okay. Yeah.
Okay.
However, I perhaps can recommend a possible method through which the above said irrefutable scientificity for naturopathy can be achieved. I mean, this could be possible by putting the patient under strict laboratory observation while he undergoes fasting, so that we might be able to have exact reports to compare between the biochemical and the biophysical changes that occur in the body before and after fasting. I leave up this missing link to the researchers or scientists engaged in the field. I mean, the case study I just presented is only a Copernican a priori view of the benefits and advantages of the method of fasting. But what we actually need is more Newtonian and Einsteinian a posteriori approaches coming to the front door of the system of naturopathy to prove its credential experimentally. Okay, I wish you all the best and thank you very much.
Thank you, Dr. Jenny, for a wonderful presentation, and we wish you good luck. Now request Dr. Manu Pradeep to do his case presentation. May I request Dr. Manu? Yeah. Dr. Manu is a consultant physician at DYAAAN Clinic of Natural Medicine at Kannur, Kerala. Today he is going to present a case on fasting and calorie restriction in treatment of Hashimoto's thyroiditis. Dr. Manu, request you to restrict your presentation to 8 minutes. And after that, we will continue with Dr. Raghuram Swaminathan's third session on molecular basis of Tridosha. We now have Dr. Manu presenting a case on fasting and calorie restriction in treatment of Hashimoto's thyroiditis.
Thank you, Rita. Can you see my presentation now?
Yes, but you will have to shift to a PowerPoint mode.
Yeah, perfect. A warm good afternoon to all of you.
Dr. Manu,
yes.
kindly switch to the presentation mode. Yes, thank you. And
is it all right now?
Your screen is slightly enlarged, I guess.
Better now?
Can you move on to your next? Yeah, I think it's fine. Yes, doctor, you can continue.
It's okay now?
Switch to the PowerPoint mode. Yes.
All right.
Yes, continue, doctor. You have 8 minutes for the presentation.
All right, okay. Namaste all, respected panelists and delegates. Good afternoon to all. So this afternoon, I am privileged to present a case study on fasting and calorie restriction in treatment of Hashimoto thyroiditis. It's a case study. And about me, myself, I'm Dr. Manu, Pradeesh. Presently, I'm working as the Chief Consultant at DYAAAN Clinic of Natural Medicine in Kerala. So I have over 13 years of international experience in treating a wide variety of lifestyle, autoimmune, and metabolic disorders by integrating fasting and other naturopathic modalities. And I was graduated from SDM, the prestigious SDM College of Naturopathy, Dharmasthala. And also later, I got trained in functional medicine from the Medical Park, Chennai. And now let us go towards the Hashimoto's thyroiditis and the case presentation. So Hashimoto's thyroiditis, it is one of the frequent autoimmune thyroid disease present in our population. And when we see the causative factors, so the causative factors can be the genetic susceptibility along with the environmental factors which is contributing to the development of this particular condition. And when we look into the prevalence of this condition, so there are around 11% in India compared to 2% in UK and 4.6% in USA. And in United States, around 90 to 95% of the hypothyroidism cases are due to Hashimoto's thyroiditis. And this is a big number actually. And when we see in Indian population, around 16.7% of the population is having high amount of anti-thyroid peroxidase antibodies. And also 12.1% is having anti-TG antibodies. So this is a significant number because there's a good number of people are suffering from Hashimoto's thyroiditis in our population. And why Hashimoto's thyroiditis can be treated with naturopathic principle. So the basic concept of naturopathic medicine, look at the root cause of the problem. So when you see a tree, the diseases can be the symptoms, and the root causes can be multiple imbalances which is creating the problem. And in this particular cases, we have hypothesized into 4 aspects which may be contributing to the hypothyroidism case, which I am going to present in the coming slides. So the major aspects we want to address was the chronic stress the patient was undergoing, and also the leaky gut, one of the common condition for the cause of autoimmune conditions, and also SIBO, the small intestinal bacterial growth, and also nutrition imbalances, and also toxic overload. So we hypothesize that once we are able to manage these conditions, the underlying root causes, so we will be able to manage this condition effectively. And this female patient, her name is Miss AM. So she was a 30-year-old female patient from Chennai, a software engineer by profession. And she came to the JSS OPD clinic with a complaint of a known case of hypothyroidism. And she was previously on modern medical treatment, which she discontinued due to stomach upset and non-improvement of symptoms. And before coming to me to the hospital, so she was undergoing Ayurveda treatment without any much improvement. And on further evaluation, we could diagnose her condition as Hashimoto thyroiditis, and we could admit her in for the treatment. And she was admitted in 2019, June month, and she was there in the hospital for 52 days. And her height was 152.5 centimeter, and when she was admitted, her weight was 78.9 kilograms, and with a BMI of 33.9, and she was classified as class 1 obesity. And the major presenting complaints, so she had a lot of presenting complaints, so weight gain and water retention, chronic fatigue, blackish discoloration all over the body, including the toe and fingernails, and multiple joint pains and frequent motion, so burning feet. So she was having a lot of presenting complaints, which was associated with the hypothyroidism. And the intervention. So when we when we hypothesized the reason, so we decided to go to a fasting therapy. And the patient was highly willing to undergo the fasting therapy because she tried everything else and she was not able to get any relief. And in this case, we did the water fasting for 20 days, during which we were monitoring all the vitals, and she was completely under the monitoring of doctors throughout the day. And after 20 days, when she had the appetite back, then we gradually reintroduced vegetable juices, and she was on a vegetable juice fasting for another 11 days. And after that, we put her on a soothing and constructive naturopathic diet for another 21 days in the hospital. So altogether, she was with us for 52 days. And after discharging from the hospital, so she was advised on a follow-up treatment, so which includes intermittent fasting for 14 days every day. And so it was like she was having a dinner at 6 o'clock in the evening, and the next morning breakfast was approximately by 10 o'clock. And also she was on a calorie restriction where only one grain food was allowed per day. And also she was advised on elimination diet where all the known allergic food or food intolerance were removed, including gluten, dairy, and soy. And also, along with the follow-up treatment, she was advised on a probiotics and multivitamins and omega-3. And the assessments, so initially we were not thinking about doing it as a research study, but later stage we asked to fill the questionnaires and do the blood test was done before, but the other questionnaires were done after that. So we assessed the symptomatic score using Solovsky's clinical score for hypothyroidism. And initially, when she was admitted, the score was 9, which was signifying a clinical hypothyroidism. But after 52 days of treatment at the hospital, and here the score came down to 3, which was on the borderline hypothyroidism. And right now, so last month, so now even last 1 year, I am following up with this patient. And last month, her score was 1. And also VAS scale for the pain. So initially when she came, it was 9, and later once we finished the treatment, it was 0. And currently she is having some amount of inflammation in her body. So, and right now her presenting pain is almost like 1 or 2. And also other assessment, we did the BMI and the weight in kilograms. So her initial weight was 78.9 and the BMI of 33.9. And immediately after the treatment, it reduced almost like 11.9 kilos, and it came down to 67 and 28.8 BMI. And currently she is having a weight of 63.2 and a BMI of 27.2. And the lab parameters which we measured, so I'm just rushing it a little faster. So the majorly we have done the TSH and also anti-TPO and anti-thyroglobulin, all were elevated in this case. And after the treatment, all these parameters, TSH, you can see it has come down to 5.53, and also the anti-TPO and also the anti-thyroglobulin antibodies also came down. And she had a lower range of thyroid hormones, and after the treatment, it all got stabilized. And currently, we have measured his TSH, which is absolutely within the range. And also we measured anti-nuclear antibodies, which again came down to normal, almost like normal, and HSCRP. So the significant reduction in HSCRP from 24.6 to 5. And also she was a pre-diabetic, in which case her fasting glucose was 142. And immediately after the treatment, it came down to 82, and currently it is 89. And also the HbA1c, it reduced from 6.5 to 5.6. And of course, ESR from 20 to 16. So right now. So in conclusion, so we could able to find that many of the lab parameters improved during the course of the treatment, and especially the TSH, anti-TPO, anti-thyroglobulin, HSCRP level reduced, and T3 and T4 got stabilized. And also there is a significant reduction in HbA1c also. And the beauty is that so all the symptoms, almost all the symptoms were improved, and she had a weight loss of 11.9 kilos immediately after the treatment, and currently another 4 more kilos. And also she is having a highest improvement in her energy levels, which was her major complaint initially. And the conclusion wise, the Hashimoto's thyroiditis can effectively treated with the fasting and calorie restriction by saying the example of this particular case. But further studies are definitely required to confirm the effectiveness of this method of treatment for larger populations. And at this moment, I would like to acknowledge the people contributed to the study, especially the JSS Naturopathic Medical College, Coimbatore, where the study was conducted, and also its principal, Dr. Naveen GH, and also my colleague, Dr. Jinsi. And also, this moment, I would like to acknowledge or thank the team, Dr. Praveen Jacob and Dr. Arun for presenting such a wonderful conference for all of us. So thank you all. Thank you. Hello.
Thank you, Dr. Manu, for wonderfully presenting the efficacy of fasting and calorie restriction in treatment of Hashimoto's thyroiditis. We wish you good luck for your future.